Hey everybody, Dr. Chad here. I want to build on what I mentioned in the video I sent out last month about trying to get back into the headspace of optimization. The question I think a lot that runs through a lot of people's minds is how do you do that? Because there's such a disconnect in our healthcare system between what health really means and what we've been taught health is. Health, as it's been taught to most of us, it's been very limited. The definition of health is so numbed to a point where most people they think of health as something that really only scratches the surface of what health is really about. Health isn't about the absence of symptoms. Health isn't about treating problems once they've arisen. Yet that's what our philosophy in healthcare in the United States has preached for years. That's Western medicine in a nutshell. You look around at how the world has responded to COVID-19. What are the countries that have struggled with it most? The ones where Western medicine dominates, where older school philosophies reign supreme. They've handled it far better than we have, for the most part. So it's interesting when you think about changing healthcare, which is always at the forefront of my mind. It has been for almost my entire career. It's been on my mind for most of the past 15 years. How do we do that? What are the steps that we need to take? What's going to be the spark that sort of ignites the next level of the health revolution, if you will? And there are a lot of things I think will influence that. I think cooperation amongst practitioners who think from a more optimized sort of goal setting oriented headspace. I think all of us uniting and getting on the same page about what it means to be healthy, not staying within our own individual bubbles. Like it would be very easy for me to base almost everything that I teach around upper cervical care. And there are certain people in my profession who feel like that's exactly what I should be doing. That I'm wasting my breath talking about stress management and nutrition and a headspace that is geared toward the elite athlete's mindset. But I don't see it that way. I think that the future of healthcare in part will grow out of unity, and certainly unity within my own profession would be great, but that's a whole different topic. I'm talking about unity amongst people who think about health like I do, like others who think like me do. People who think about health and want to see that people become the best versions of themselves. Symptom-free, that's certainly a great thing to become. That's a big process for most of us. That's a process that by the time people often reach our doors is months, years away. But then sustaining the habits necessary to get there and stay there, that's what health is about. Health is about habit forming. So there are projects that I have in the works that I'm excited to present to you. There's a digital version of our new patient orientation class. It's a health awareness type workshop that we used to host in person for a long, long time before COVID. I sit here recording this March 11th, which, like September 11th, to me is just going to be remembered as a day in infamy forever. And we'll try to recontextualize it in the coming years as we have with 9/11. We'll try to remember it for something other than the turmoil and chaos that it created and the tragedy that it has been in so many ways. But I sit here on March 11th and I think everything we've seen over the past year perfectly exemplifies why we have to change the way we think about health. The last year, all we have done is figured out how to run and hide rather than empower ourselves to fight, to really fight. In the newsletter that I sent out for March, I shared some statistics that I found very interesting that a friend of mine who has been tracking over this whole time. And I had said back in June of last year, I thought that based on the statistics I had studied with infectious disease in the modern era, that we could expect about 8% of the population to become infected with COVID. And sure enough, his statistical model that he came up with that tracks the number of tests given versus the number of positive tests is about 8%. And it has been the entire time, pretty much since we collected a large sample size of data. So my question then, and I'll pose it again to you now, is Why are we spending all of our time studying the 8% who get sick instead of studying the 92% who don't and figuring out how they don't? Because that's health. That perfectly exemplifies the problem we have. I've asked this question a lot over the past month in the office in a lot of different contexts, but it's, are we going to trust that the body is going to figure things out, or are we going to fear that it won't? And all we've done over the past year is we've gotten, as a society, we've been in the fearing it won't mindset rather than the trusting it will mindset, that it will respond and that it will persevere. How do we make it persevere? How do we make it more likely to do that? So I'm excited to present to you this health workshop when it's finished. It's going to be very well produced. I'm looking forward to that. I also, a couple of summers ago, recorded a documentary with a couple of like-minded individuals who we had a really good series of conversations that got recorded and taking what they think and taking what I think and putting them all together in this nice flowing vision. The name of the documentary is Changing the Way We Think About Healthcare. And I'm finishing that up next Friday and should have a rough cut ready and hopefully be ready to send that out to you as well. Health awareness workshop will come first. The documentary will come after that. I've been heavily involved in working on a book, probably sort of loosely titled Changing the Way We Think About Health, because it's time. It's time to take those next steps. It's time to figure out who or what will be the spark that ignites the healthcare revolution to the level it needs to reach for healthcare to truly change. So many aspects of it need to change. And I ask you this, do you want to be a part of the problem or do you want to be a part of the solution? I think that's a powerful question. And I don't mean it to sound so aggressive, but maybe it's time we start getting more aggressive with the questions that we ask on this topic, because we're fast reaching a point in history where so many more people are going to suffer than need to suffer. So many people are going to remain sick and tired of being sick and tired because they don't know what health is. They don't know how to achieve it because no one's teaching it to them. We got to expand our efforts. We got to get out there and teach and educate and spark these conversations. And I mean, we'll need your help. We will need your help to do that. So, think good things. Everybody be well. Hopefully, springtime will bring us that much closer to a real normal and not the quote-unquote new one. So, all right. Everybody be well. Talk to you soon.